Alright, Denise, we're about to take you through a pre-exercise screening tool. This is to give us as much information as possible for your medical history. The reason we need this is to find out anything that may be already present that might be harmful to you during exercise. It can be something as simple as a sore hand through to something as serious as a heart condition. We're going to go through stage 1 and 2 today. Completing this form helps us to determine what exercises you can perform and at what intensity. It also tells me if we need to refer you to your GP for a medical clearance before you participate. Are you happy for me to continue these questions?
Certainly.
Alright, so the aim for stage 1 is to identify those individuals with a known disease or signs or symptoms of disease who may be at a higher risk of an adverse event during physical activity or exercise. This stage can be self-administered, but I'm going to help you out with it today. Has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
No. Have you ever experienced unexplained pains in your chest at rest or during physical activity or exercise?
No.
Have you ever felt faint or have dizzy spells or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No.
No. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
No. If you have diabetes, have you had trouble controlling your blood glucose in the last 3 months?
No.
No. Do you have any diagnosed muscle, bone or joint problems that you have been told could make worse by participating in physical activity or exercise?
No.
Do you have any other medical conditions that may make it dangerous for you to participate in physical activity or exercise?
No.
No. Alright, so you've answered no to all 7 questions and you have no other concerns about your health, so you may be able to proceed into undertaking light to moderate physical activity or exercise. I'll get you to sign down the bottom. Okay. Alright, so we'll continue on to stage 2. So the aim of stage 2 is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. This stage is to be administered by a qualified exercise professional, so I'll take you through today. What is your age?
59.
59, and you're a female. So this gives you a risk factor of +1 just to being over 55 years of age. Do you have a family history of heart disease or heart attack?
No.
No. Do you smoke?
No.
No. Describe your physical activity or exercise levels at sedentary, light, moderate or vigorous?
Moderate.
Moderate. And how many times per week?
6.
6. For how long each time? Either each time or in total?
Well, I do 1.5 hours a week at the gym.
Yeah.
3 times. I do 5 hours a week of line dancing, and I walk 3 or 4 days a week. Anything from 1 hour to 4 or 5 hours.
All right. That puts you into -1 category, so you do well over 150 minutes a week, which is the recommended activity level above that. And we worked out your BMI is 24, so that gives you a 0 there as well. Have you been told that you're high blood pressure?
No.
Have you been told that you have high cholesterol?
No.
Have you been told that you have high blood sugar?
No.
No. Alright, so this gives you a total of 0, just for your risk factor of your age being +1, and then your current exercise levels gives you a -1. So that puts you in the 0 range, which is good. Have you spent time in hospital, including day admission, for any medical condition or illness or injury during the last 12 months?
No.
Are you currently taking a prescribed medication for any medical conditions?
No.
No. Are you pregnant or have you given birth within the last 12 months?
No. No secrets.
Do you have any muscle, bone or joint pain or soreness that is made worsened by particular types of activity?
No.
No. Good. So now we need to assess your risk stratification. From what you've answered, you've got a score of 0 today, which gives you a score of low, so you can be low, moderate or high. So individuals at low risk may participate in aerobic physical activity or exercise up to a vigorous or high intensity. So if we go back to page 2, it shows that vigorous and high intensity, you can work up to a heart rate max of 90% or more, which gives you a rate of perceived perception of around 7. So this is a good score for today, which means that you can participate in your programming today.
Good.
Yeah.
Thank you.